and the immune is not really strong. The immune that will fight this infection is not strong anymore. So the individual is now prone to so many infections. We have fever, we have vomiting, we have belly pains. These are symptoms of vaginal fistula. Then we have causes of vaginal fistula. Childbirth, which occurs the abnormal tearing of the genital women part of the reproductive system. We have the abdominal surgery, incision, improper incision that was conducted. It causes this vaginal fistula. We have traumatic accidents like car accidents, motorcycle accident. Okay. We have retardation treatment, a treatment that wasn't cured properly. Retardation treatment. These are most of the causes of vaginal fistula. And again, we go to the word diagnosis. The diagnosis, we'll be talking about 3 because we don't have much time on our side. We'll be talking about the dye solution. This is a process whereby the doctor will add a dye solution to the bladder, then ask the patients to cough. If the dye leaks into the bladder, if the dye leaks into the bladder, then you know you have this vaginal fistula. Then we have the cystoscopy. Yeah, the cystoscopy. This is a situation whereby the doctor is going to fix a device into the patient for a proper check on the ureter, the urethra, and the bladder if there is any damage. Then we have X-rays. X-rays most the one we see often and common. X-rays. Then we move to the treatments. Treatments. Sometimes vaginal fistula heals on its own with time, but in most cases the doctors will add a tube called the catheter. A tube called the catheter into the individual's bladder so that it will dry up the pee, so that it will give the vaginal fistula time to heal on its own. We have the time to heal on its own. Sometimes, in most cases, there is this plug being added. This plug that is being added to the body, that is it's made up of proteins. It is being used to seal the fistula so that it will have time to heal. In so many cases, surgeries are recommended depending on the type of fistula the patient has. So good people, we'll be awaiting your questions on this very topic, the vaginal fistula. So women, try and keep up from any exercise that will stress the female reproductive organ. Because stressful exercise, strenuous works do have effects and might result to a vaginal fistula. We thank you for listening to our show today. Keep your question coming in on our WhatsApp platform, on our Instagram platform, Mr. Joe 1249. That's our Instagram platform. Go there, you'll see so many of our videos. We thank our sponsors, and we will always do our best to bring the best informative subjects. Remember, in Biosphere Arena, every living thing counts. See you next Friday for a more educative subject. It's once again your presenter, Ukemeze Joseph Nzubeji. See you on Friday.